A measles outbreak in the northwest part of the country is leading to new concerns about a lack of vaccinations in some communities and just who may have been exposed to the infectious disease. Public health officials in Washington across the Columbia River from Portland, Oregon, say there are 35 confirmed cases in Clark County. 25 of them are in kids who are 10 years old or younger. At least 31 of those cases are among those not immunized. 2 other cases are confirmed in Oregon and Washington. The area is considered a hotspot, so to speak, when it comes to lack of vaccinations. Sreenivasan spoke about that very issue yesterday for NewsHour Weekend with Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases at the NIH. Hari asked Dr. Fauci if he was surprised that so many of the infected were not immunized.
I'm surprised and disheartened that there are so many people still who are not vaccinated against measles. The idea that the overwhelming majority of the people who got measles were unvaccinated is not surprising at all. That's exactly what you would expect, because the measles vaccine is one of the most effective vaccines of all vaccines that we have. If you get the 2 doses that are prescribed that you should get during childhood, one at 11 to 12 months and one at 4 to 6 years, it's 97% protective.
You know, Clark County is in the southern border of the state with Portland, Oregon, or I should say the state of Oregon, and it's kind of seeping out. There are concerns in the Portland area as well. But, you know, it is up and down the state that in that state there seem to be clusters, similar to other states. How do you change that? Because there are lots of states that actually give families the option to not vaccinate their children.
Well, I think that you have to be much more strict about the flexibility that you give to so-called philosophical objection to getting vaccinated, because that gets abused. And when you get below a certain level of the percent of people in the community that are vaccinated, that's a disaster waiting to happen. You have to have at least 92 and as much as 95 or more percent of everyone in the community vaccinated in order to get that umbrella of what we call herd immunity protection. Once you get down below a certain level, it's just waiting to have the kinds of outbreaks that you're seeing now in Washington state, and that we've seen and are seeing even in New York City and in New York State, where among certain populations, such as the Orthodox Jews, who have a lower level of vaccination, that same sort of danger and vulnerability. So we've got to get past that and get people educated to realize that this is a serious disease. And when you stop vaccinating or give excuses for not vaccinating, these are the kind of things that are going to happen. And the thing that people need to appreciate is that the idea that measles is a trivial disease is completely incorrect. Before vaccines were available, measles was one of the most terrifying diseases that you could have. Globally, there were millions of deaths each year. And in the United States, before we had the vaccine that was widely distributed in the 60s, there were a couple of million cases, 400 to 500 deaths a year, and 1,000 cases of encephalitis, which is an inflammation of the brain. We don't want to go back there, even if it's in individual communities. That's a terrible place to be.
Put measles in perspective. What happens with measles and why is it so contagious?
Okay, so the typical case of measles is a child gets a fever, they get a running nose, they get a conjunctivitis or inflammation of the eyes, they get a cough, and then they get a rash. A couple of days later, they get a rash, starts off in the face, goes through the body. Most of the time, it recovers. It's very uncomfortable for the child, but if you look at the statistics, 1 in 10 who get measles get ear infections that can lead to deafness. 1 in 20 get pneumonia. 1 in 1,000 get encephalitis, which is an inflammation of the brain. And 1 to 3 or so per 1,000 individuals who get measles actually die from it. So the idea that anybody's saying it's not a serious or potentially serious disease is just incorrect, period.
To put this number in perspective, this is already about 31 cases that we're talking about just in the state of Washington. But this is in the larger trend line. Is this getting better? Is this getting worse?
It's getting worse. And unfortunately, the anti-vax movement in certain segments of the population, certainly not generalized, is just growing, and it's getting worse. And it's based fundamentally on misinformation. You don't want to denigrate people who make those kinds of decisions and essentially attack them. That doesn't work. You've got to understand they have these beliefs, and the way you try and get them to understand the importance of getting vaccinated is talk about the facts, talk about the evidence. Don't attack them. And sometimes people tend to poo-poo them and attack them. You've got to understand they have these beliefs, but if you present them with the facts, you may be able to win back a substantial proportion of them. I think some of them you never will win back to the issue of being able to realize the importance of vaccination. But I think you can try, and I know you can try, to get the facts to them, and some of them will change their mind. One of the things that's really interesting that people don't seem to appreciate, that it's an interesting a bilateral thing, where on the one hand, measles is one of the most contagious infections in history. And on the other hand, we have a vaccine that's one of the most effective vaccines of any in history. And it just seems such a shame that you have a disease that, if left unchecked, can rampantly spread. And yet you have a tool, a safe tool, a proven safe tool that can stop it in its tracks. That's the evidence that we've got to get to people of why it's so important to vaccinate yourself with a safe vaccine, which is the measles vaccine.
That was Dr. Anthony Fauci of the NIH. We'll continue to watch this outbreak in the coming days.